as India has reported over 2.64 lakh new COVID cases in the last 24 hours. The COVID cases are on an upward trend in the country, with major metro cities continuing to report this spike. In fact, Delhi is the worst hit metro, as its daily case count has now risen to more than 28,000 in the last 24 hours. Now, 31 COVID-linked deaths have also been reported from the national capital. And today, Delhi Health Minister Satyendra Jain also highlighted that most of these COVID deaths are due to the people who have not yet gotten vaccinated. But this brings into the question, what exactly are the precautions that need to be taken by us at a personal level, and what should be the focus for the state government now in terms of their COVID strategy? And to discuss further, let me bring to the broadcast my guests who are joining me this afternoon. I am joined on the broadcast by Dr. Suneela Garg. Ms. Garg, thank you so much for joining me. I'm also joined, as far as this particular broadcast is concerned, I am also now joined by Dr. Salve. Dr. Salve, thank you so much for joining me. In fact, this is a very, very important discussion that we are about to have. But let me actually take our viewers to the numbers that we're talking about here. 2.64 lakh new COVID cases in the country, and that too in just 24 hours.
Very important issues about the rising number of cases. But what we have to see is that we know that we are dealing with a virus which is very, very infectious and highly transmissible. And if we will see some of the states, when we look at Maharashtra and all that, Delhi, probably, after the cases will peak for some time, but gradually we are on towards the decline. That is one thing. But we have to be also worried about the states of Gujarat, Bihar, Jharkhand and all that, where you see the cases are increasing, and we have to be watchful over there also. But also we should be comparing our infections and deaths 14 days back. If I was to look at the infections which happened 14 days back in different states, along with the number of deaths, we will find that the case fatality rate has not increased, because at that point of time, the infections were very, very less and the deaths were high. So that is one thing which you have to keep in mind. But the message from this point is that the people who are getting infected are the ones who are either not vaccinated or partially vaccinated. That is one thing. Or they are suffering from comorbidities like diabetes, hypertension and all. So that is one thing where we have to be very watchful, that people who are suffering from comorbidities, they must keep their diabetes, hypertension or any other immune disorders which they are suffering from under control, and they must be consulting their doctors regularly. And if they have any symptoms, they must report as early as possible. And if possible, only home isolation should be done under doctor's advice. But it is a transient time where we have to be very watchful. But we all know that peak is going to come soon, and then the flattening is going to start.
All right, Dr. Salve, in fact, Dr. Garg here mentions that the peak is going to come soon. However, we did get certain numbers where people were starting to discuss that the curve might just be flattening. But do you think it was because of the weekend numbers where there were more unreported cases or not many people were venturing out? It was because of that we were seeing lesser numbers?
Yeah, thank you for having me on your show. First thing we need to understand, and this is now we are in the third year, I will say, as far as the COVID pandemic is concerned. This number only indicate trends. This number doesn't indicate the actual numbers. Actual numbers are more than 50 times the numbers reported, because we are only testing 5 to 10% of the cases in the community, as majority of the cases are asymptomatic, almost 90%. So our testing is only happening at a 10% cases, which was there in last 2 years also. So these only numbers indicates the trend, which will help us to understand only trends where the pandemic is going. So we should be aware of this fact. Second fact is very important, that as you see in the South Africa, where the Omicron is a predominant variant 2 months back, The cases peaked in almost a 1 month time. The similar thing we expect here in India. You might land up in the day where you will see the almost 5 lakh cases reported, but soon at the end of the January or the first week of Feb, you will see the decline in number of cases. The decline in the number of cases happened similarly in the Delta time in the April 2021. Similarly, in the this time also the decline will happen only and only because of the spread of the virus across the community. When the almost 80 to 85% of the community get this virus, then the decline happens. Because if you see the R0 of this Omicron variant is landing in the numbers of 3.624. So if we do the epidemiological calculation, when the 80 to 80% of the people in the community get the infection, the transmission slows down and it ceases to exist. The blessing in disguise with respect to Omicron is this is a very milder variant as far as the COVID is concerned. As far as the profile of the patient we are seeing so far, it is infecting the upper respiratory tract infection, and that is causing a coryza, cough, and some common cold-like symptoms. So that I will say the blessing. So, and most of the infection are asymptomatic. As far as the prevention is concerned, again, the mask use remains the key, particularly in the indoor setting, and the ventilation is the key. Of course, as mentioned by Professor Garg, that management of the comorbidities is very crucial at this moment, be it a kidney disease, be it a cardiac disease, be it a diabetes mellitus. Because what is happening due to the COVID, the non-COVID healthcare is taking a hit. So we as a healthcare providers, as a policymakers, the message is we should prioritize the non-COVID care also. And because that is what determines the mortality, which is very minimal as far as the Omicron is concerned. So non-COVID care is the critical care if you really want to reduce the mortality in this COVID pandemic.
Absolutely. Dr. Salve, thank you so much for sharing your views there. Now, Dr. Garg, since Dr. Salve has also mentioned about the lesser mortality rate as far as this variant, Omicron variant is concerned. However, this should not actually go ahead and induce the people to drop their guard. That's very, very important because before we started this discussion, we did mention about what the Delhi Health Minister, Satyendra Jain, also mentioned about the number of fatalities in Delhi specifically. All of those people were not even vaccinated.
This is one thing which I had mentioned earlier also, even not only in Delhi, but across the country, when we see the people who are, getting hospitalized are the ones who are not vaccinated or partially vaccinated. This is one thing which you have to keep in mind. So that is where, when we are talking of the precautionary dose, booster dose, for elderlies and for healthcare workers, frontline workers, one thing which becomes very crucial at this point is that everybody will be only eligible of these categories once they have received 2 doses and they have crossed 39 weeks. So it becomes all the more very important that first of all, everybody should get, those who have not got any vaccination should get vaccinated with 2 doses at appropriate intervals. And those who have got 2 doses should wait for 39 weeks, basically if they're falling into the category of healthcare workers, frontline workers, because they are the ones who are much more vulnerable, including the elderlies, to wait for their precautionary dose. So it is important to not only take the vaccination, but at the same time, do not lower your guard, follow COVID appropriate behavior. So in terms of, and mask is a very, very important social vaccine, which has been repeatedly told on your platform as well. So we need to be very careful. But as far as, as I'm telling about the number of cases growth factor, overall, if you will see, the growth factor has become 0.95 if you will look at total cases on 14th of July. So that is one thing which you have to keep in mind. But overall, if you have to take the deaths, these deaths are the ones, basically which have occurred today, have had the infections about 14 days back. So 14 days back, proportionally, the number of deaths in the country were higher and infections were less. So that is how, we have to see that it is amongst those individuals, we have lost the people today, those who suffered from infection about 2 weeks back. So that is where I'm talking about that our case fatality rate is somewhere around 1.335. It remains the same, today, yesterday, it was almost the same. So we have to view the data very, very carefully. We should definitely look at the numbers within the state, even if they're small, and look at the verbal autopsies, how these cases are happening, and what is the reason for these cases. But at the same time, we have to be mindful of our statistical data also as to what is happening across different states also. Thank you.
Right. Thank you so much, Dr. Garg. In fact, Dr. Salve, I want you to come in here. There was actually a data that was released by one of the European nations. Now, that said that COVID should be declared an endemic disease rather than treating it as a pandemic. And, there has been ample debate and discussion after this particular stuff has been said internationally because of the kind of cases that we are seeing, not just in the country, but across the globe. So, your word here, sir. Do you really think that we can afford to go that mild when it comes to COVID-19?
I am very thankful to you for bringing this very important point here. We as an epidemiological fraternity are saying this since long that we should treat the disease as per its merits. The Delta was a serious variant when it was affecting the lung and causing a severe illness. But now when you see the Omicron, it is affecting mostly upper respiratory tract infection. And definitely what is happening with the common cold, with the rhinovirus. And the fate of this COVID it will be endemic. Let me give you one example. We had a SARS pandemic in 2004. Currently also we see the SARS cases almost 20 to 30,000 cases per year. It has become endemic. The similar fate the COVID awaits. So our response should be like that. Our response should not be the closures of everything that affects the lifestyle of the vulnerable, that makes people more vulnerable, people to suffer to their livelihood, and that leads to the mortality and the morbidity. So we need to be very vigilant of the existing fact, what we are seeing, the evidence, and our decision should be science-based, not the panic-based and the assumption-based that this will happen, this will happen. We really need to see the contextualize our decision as a country. We have to see the social mixing happening at the country. Even if we close the broader roads, people are mixing under tributaries, people are mixing the rural areas. So we have to take the science-based decision. We have to take a rational decision as far as we really want to respond to the COVID pandemic in the future.
All right. Dr. Garg, would you like to add to that? Because this is something that, in fact, was quoted. And I'd like to bring in this particular fact here because we have on Mirror Now been reporting this, that while the rules continue to be for the common man, we are seeing ample flouting of the COVID-appropriate behavior and the COVID protocols by our netas. And this is the logic that they have gone ahead and given, that we have to live with COVID.
Yeah, definitely. If we see the future, we have to live with the COVID, and that people are now, we are in the third year, people are accepting it, and majority of the people getting vaccinated, so severity of the illness has been minimized over a period of time. Now see, and most important thing which I like to inform and I like the media people need to discuss, the role of natural immunity. See, the natural immunity is the superior level of immunity. Now the people across the globe, they are debating it. So once the people get a from the COVID, the need
Dr.
of the
Salve,
vaccine.
in fact, I'd like Dr. Garg to take this. Yeah. If Dr. Garg could take this, please.
Important issue which we have to see, that as has been pointed out, that when we have been seeing all these pandemics of since 2004, over a period of time, the infection becomes endemic, because the virus mutates and gradually it loses its virulence also. The same thing which we saw in cases of flu also, swine flu also, over a period of time. So you see, when this is, the things which are happening with the pandemics over a period of time, the virus loses the antigenicity and it becomes endemic in a population. But then at the same time, we have to be very watchful, because when we are in a declining phase, these are all our assumptions and which are based on epidemiological perspectives as well. So when we are looking at that the number of cases are declining, but particularly now, there's a lot of difference between what happened in 2004 and what is happening in 2022. We are all a aging population. We have much more aging population as compared to the earlier days. So we have got, with the aging population, we have got much more comorbidities also. So that's why we are getting, more severe cases also of those who are dying, though the cases are few. But over a period of time, you see, we will be able to protect this, and we have to be prepared for this, that off and on, we will be getting pockets of infection from different parts of the state. So, but then we have to be prepared for this. And now you see, we have got emergency use authorization of the vaccines, but then over a period of time, the vaccines, will have to be relooked into. And then like some WHO is giving, every time, every year, the different strain of the H1N1 vaccine. So that is how we will have to look at it over a period of time. But till that time, we have to presume that, we have to be watchful about this declining situation of the infection, and hopefully we presume that it will come down by middle of February and the life can come down to normal. But then the lesson learned from this pandemic is that, and from the earlier one also, which we saw in cases of even as long as back at Spanish flu also, that, not to, kind of at that time also we were talking of, face cloth, face mask and all that, but not to lower the guard. That is important part, which I'm again and again emphasizing, because you see, now we have got availability of masks, medical masks, surgical masks, cloth masks and all that. The blessing in disguise is that we are protecting ourselves from other respiratory tract infections also, including, when we talk of flu and all that, even severe diseases like, chronic diseases or communicable diseases like tuberculosis, transmissible diseases, they're also, transmitted through respiratory route. So most important is be watchful. It is will go towards endemicity. It is already the declining trend. As I told you, the growth factor is 0.95 today as against +1 yesterday. So this is where we have to be watchful of the figures, but we have to be not lowering our guard, but at the state level, we have to be very watchful about the number of hospitalizations and the number of deaths. We have to be very careful about that.
Right. Also, Dr. Salve, Metro seeing most amount of these cases. Is it because of people reporting it, more and more tests that are happening, or is there a specific reason why metro cities are the worst hit?
More activity which happens at the metro, be it economic activity, be it a mixing of the people. Second thing, in the metro, most of the people live in the closed environment. So, the spread occurs more in the indoor environment. So that is an important reason. And third, obviously, the testing and the awareness among the people with respect to the symptoms of the disease and the health-seeking behavior for a positive related to the testing behavior is concerned. So that is there. So obviously, you will see the more cases currently in the metro. But I am sure you will see subsequently in the months to come, the cases more happening in the rural areas, more happening in the northeast areas. What has happened in the last years with the Delta? So this will follow the same pattern. The only difference being that you will see the hospitalization, which is very minimal. So critical here, as far as I am concerned, or epidemiological point of view is concerned, that first we need to strengthen our hospital surveillance. We need to strengthen our genomic surveillance, because new variants will going to come subsequently. We already few variants are reported in the France recently. So the strengthening of the hospital surveillance, genomic surveillance. And also one point I like to put in here, that how we are defining our COVID deaths. That is very critical when we are debating the deaths number. So what is the definition of the COVID death? There is a debate going on across the globe that we should define it as COVID associated death and with a COVID death. For example, some person is dying due to the COVID and some person is died due to the other illness but tested positive for the COVID. So we really need to move in this direction as a country, as a hospital
Dr.
surveillance
Salve,
is concerned.
you seem to
make
be
some
the
sense
father, you on-duty father on, today, as you're working from home, we can hear your child, on the broadcast. I'd let you cater to him. I'll let Dr. Garg actually take this also, because a very important point that Dr. Salve has raised about genomic sequencing. And right now, there has been an ample need that has been put forth, Dr. Garg, about the genomic sequencing to determine the variant variant, the dominant variant, which we're talking about as far as the Omicron is concerned. So just your word here, ma'am, about genomic sequencing and the importance thereon.
Yeah, definitely. It's a very, very important, question which you have asked. And about, 2 days back, we had a meeting with the Union Minister of Health, where I am on behalf of OMAG Association. That means this is a combination of 15 professional associations. We said that we have to be watchful of genomic sequencing, but somewhere we need to, revise our data. At least if we do 100 samples per state per week, we need not go overboard. We had to look at, every case need not be subjected to genomic sequencing. We have to have approximate representative data where we go, regularly and be watchful about all the cases on a sample basis as to what are the variants which are coming, so that we know that, which kind of variant is there. Like we got from Africa this time, earlier Delta variant came from Amravati. Now that's how we, which was responsible for second wave across. So we have to be really watchful of the mutations, because some mutations, though we presume that the virus is going towards endemicity, but genomic sequencing is not only important from research perspective, but also from the disease perspective. That is important. But another thing which I would like to say is that though metros are seeing larger number of cases now, but if you closely watch the data about though the basic apparent number appears to be small, but percentage rise is much more. If I was to talk about that, the Delhi has got, about 7,000 increase in number of cases, so proportionately the number is less. But if you look at the other states, the proportionate number of cases are higher, and we need to be very watchful of those areas, because our healthcare delivery system across the country has to be prepared. Because Delhi, Maharashtra, or Pune, or when we talk of, Chandigarh and all that, may be having, very good amount of healthcare this thing. But when we talk about the mid or, the lower level cities, or the second to level three tier cities, we need to be watchful about preparedness of those systems, preparedness of, the testing, treating and tracking part also. So our testing also has to keep in pace with the infections as well. So that will give us more this thing about the containment part also. That is, these are some of the important things.
Absolutely. Dr. Garg and Dr. Salve, I'll open the floor now. So what are the precautions that are a must follow that you'd like to tell our viewers in the wake of these growing number of cases that we are reporting by the day, every day? This is over 2.5 lakh cases in the country in just 24 hours that we are looking at. So the important precautions that everybody must take, whether they are going to work, which is obviously a dire need, or they are working from home, staying at home, what is it that they should go ahead and ensure?
Number one, this thing is that across, irrespective of rural area, urban areas, whether you are in traveling, whether you are working, all the times you see the COVID appropriate behavior is number one thing. Not to lower your guard at any time. Mask above the nose and below the chin. That is important. Number two is that maintain the adequate distancing, and then the personal hygiene. Washing the hands very often is very important, and try to, be in open ventilated environment. Do not have ACs environment, and have your windows open. That is important. Another important thing is that we have almost about, of the infected cases, majority of them, that is, I'll say that more than 90% of the cases are in home isolation. So they also have to be in well-ventilated room, following all the COVID appropriate behavior and monitoring their oxygen levels also with the help of pulse oximetry. And it has to be, above 93, and they have to be in contact with their providers. And if they're suffering from any comorbidities, that is another important thing which they need to be, telling their healthcare provider. Even the family members need to be aware of. And even, within the family, if there is there are two people who are infected and three are not infected, they may be asymptomatic, but there is no need to go overboard for the testing part. If anybody, let's say if there is one person who is suffering from that, he can get himself, he is curious to know, he's self-empowered to, do his antigen testing at home itself. So one is that part. The second part is that go for vaccination. As of now, that is, these two things are the most important things, and do cooperate with the administration with the, when they're insisting on COVID appropriate behavior and all that, that is important. So these are some of the important things.
Cooperate with the administration and maintain COVID appropriate behavior. Dr. Garg and Dr. Salve, I'm really sorry, I'm really short on time on the broadcast, but thank you so much for joining me with those important points that you have put forth as far as COVID is concerned and the precautions that people need to take so that they don't go ahead and contract the virus. Thank you so much for joining me on the broadcast.